So welcome back, everyone. I'm Jeff Hyman, veterinary homeopath, licensed veterinarian, and that's Gail Pope, founder of Bright Haven Shelter in California. I'm one of the leaders in hospice care, which is really just good end-of-life care, happiness care for our companions as they age. And I guess you told us last week that officially the definition of going to hospice is with a terminal illness, and it's usually within a couple of months. So is that right, Gail?
Technically, hospice care is pretty much the same for animals as it is for people, and it begins once you receive a terminal diagnosis in most cases, and that's generally approximately 6 months before the end of life. For us, it doesn't quite work that way. We call what we do hospice care, but we're offering healing to the end of life and beyond, and we don't necessarily have a terminal diagnosis with our animals because we don't necessarily work that way, and we don't often do the deep kind of diagnostics that begin that kind of fearful end-of-life journey. We're just literally working all the way to a beautiful, peaceful ending. But yeah, most often it's approximately, you can see the winding down period is approximately 6 months.
Yeah. So I had wanted to actually use that concept of winding down and go from the end to the very beginning. And that's going back to the fact that we never really covered the very, very basics of what it is that homeopathy and what I do in practice and what Gail is talking about as far as the winding down of the body. And that is that our main goal in veterinary medicine and life itself, and certainly it's important for having a good life and a good death as well, is we want to work on building vitality. So everything we do from day one should be based on, or is based on, trying to increase the healing ability of the body. And that healing ability is directly related to the vital energy that we all have within us. And there are certain ways that we can promote that and help that and foster that. And the more we do that throughout life, the better our life is, the fewer the symptoms that we have, because symptoms are a sign of imbalance, of energetic imbalance, as manifested through the vital energy of the individual. And as we get close to the end of life, that vitality begins to wane, and as it decreases, we begin to see decreased energy, externally visible energy, decreased appetite, and eventually, just hopefully going to sleep and not waking up. But the reality is that in our culture, where the vitality has pretty much been ignored in modern medicine, can't really explain why one body is alive and one is dead. They can explain the physiologic changes, but why did that heart stop pumping? Why did that person stop breathing? And that is going to be directly related to the level of energy that's within the body. And that energy is actually what allows us to manifest symptoms and have a good life, or have any life, actually. So Gail, what do you do there to foster the vitality, to foster the healing ability of every individual?
Well, that was wonderful. I enjoyed listening to that. You said that really, really well. And what came to mind for me was that several things, if I can remember them all. Will to live is the thing that stands out most of all, and that goes hand in hand with the vital force and the vital energy. If there's a will to live, it can be quite astonishing to see how beings. Excuse me. Let me take that off the hook. Sorry, I forgot to do that.
No problem.
Yeah, I've actually just not. I wish I was more techie. Well, I can't hear anything at all, so I'm not sure what I've done with that. But yeah, I think it's to do a will to live. You know, when we talk about the 6-month period in hospice care, we also have to back up to very often what we call a wake-up call, and we see it with animals coming here who ostensibly come to us for hospice care. Their will to live is sinking. They have this or that chronic illness going on, and it would appear that they're approaching the end of their life. So to us, this is very often really a wake-up call that we need a little more balance here, and maybe we do, maybe we don't, but when we start to take into account body, mind, and spirit, and we put them all together, we care for the physical self. Love is the most important thing, as I say over and over again. Oh, I guess I did. And, you know, when you start to pull together, for us, it would be homeopathy, a good diet, Reiki, some form of energy healing, and just making that being as happy and beautiful as they can be. And the healing journey will take itself into new and renewed health, or it will take itself through the end of life journey, however long that is, and into a very, very peaceful, natural dying process, because it's following the way that Mother Nature intended it to be. Does that answer the question?
It does, and I think you hit on a very important point. Thank you for that. And that is that one of the best ways to build vitality, to promote vitality and healing, is by sticking close to nature. You know, Mother Nature really does know best. So, you know, in the natural environment, and you know, we'll say in the wild for animals, they're not eating processed commercial foods. They're not having their symptoms, you know, combated with steroids and antibiotics. And, you know, I think the bottom line, Gail, is that it's much easier for us to dampen and decrease the vitality than actually promote it. And, you know, we'll talk further about the ways to promote it as you started to do just now. But, you know, I want to just get up on my soapbox and say that in my understanding, my observation, the very greatest way to dampen the vitality is to suppress symptoms. Your vitality, your body is trying to manifest some internal energetic imbalance by showing you a symptom, by showing the world a symptom, by creating a symptom. If that symptom is now artificially inhibited or suppressed or taken away or stopped altogether, you may lose the symptom, but you're going to increase the actual internal disease. So sometimes, you know, we talk about you're driving the disease in, but you know, in reality, I think that you're just thwarting the work of the vital force. And so, yep, suppressing symptoms is, to me, the greatest harm that you can do to any individual. And of course, then we get into the, you know, the feeding fresh food versus commercial processed food, vaccinating, drugging, and all the other things that can be done to decrease vitality. But when, if ever, to find the need nowadays, now that you know about homeopathy and holistic supportive care, Gail, when, if ever, you find the need to get rid of any particular symptom? Is there any symptom that you feel that?
That's a really good question. You know, Jeff, I'm just noticing on the questions here, the fast pup must have not been here at the beginning and is just asking if we would mind reintroducing ourselves. So would you like to go ahead?
Sure, Kate. I thought you knew us from previous years, but previous weeks. But I'm Jeff Hyman. I'm a certified veterinary homeopath here in Connecticut. And that's Gail Pope, I don't know what direction you're sorry, who runs the fantastic Bright Haven shelter in California. It's a haven for sick and older animals. And she is a leader in the world hospice movement. And Kate just talked a little bit about, the beginning and the end of life, as far as, we try to build and foster vitality. And then Gail was talking a bit about, how the body manifests actually the gradual decrease as we get older and die of the vitality, and supporting the body with hospice care. So that's who we are. But Gail, you were gonna finish or answer whether there's any specific symptom that you find the need to either get rid of, you want to treat, and it may be just, itchy skin that you just want to stop the itching. I'm just wondering what is problematic for you guys.
It's kind of a multifaceted question because, I don't believe it. I thought I'd switched it off. Sorry if I answer it and then press the off button, it should go away. It is difficult because there are, I've been taught, if you like, in all the learning in the last nearly 30 years that symptoms are my gifts, and they're what are going to give us the clues to find the road back to healing. And so with that in mind, there aren't very many symptoms that I regard as like the snapping beast that I have to put away. Now something does. Oh, excuse me, I'm sorry, I'm going to run away with this.
Okay. Sorry. I believe what Gail is saying is that it's really, really important. It may be the most important thing that you can do for your animals to learn how to put symptoms in their proper context. And
right, I kind of lost my thread for a moment, but I know it's coming back. The one that comes to mind, which is a symptom that we do suppress a little bit, actually, is one that you're very familiar with. Jeff treats one of our dogs who's diabetic. And as part of her diabetes, when she came to us, she was on quite a high level of insulin. And along with homeopathic care, we're gradually reducing that level. So in that way, we're still giving her a drug, and the insulin is suppressing. However, we're balancing that with the healing pattern, and she's very gradually finding her values are coming down lower, and we hope she has enough time on this planet that she will achieve a full cure. So sometimes, and you were talking about skin problems, we don't suppress those kinds of symptoms with drugs. We work with them naturally via homeopathy. And yes, we use soft holistic gels and something to soothe and comfort the skin. The skin is the largest organ in the body, and I think we very often forget that. We put all sorts of stuff on it and expect that it doesn't really do any harm, and yet it can do. So we're very, very respectful of what we do with the skin. Does that go somewhere towards
it does, and I think that that's very, very important. That you mentioned the skin is the largest organ in the body, which is so true and so important. But what we need to do, I think, is put everything in context. So if you have an itchy or red skin, that probably is not as life-threateningly important as, say, a liver or kidney or brain or diabetic problem. So I think that you can make your decision on how much to support the body, how much to palliate the body, because we don't suppress that often. I think the insulin for the diabetic is just artificially lowering the lowering the glucose, not really suppressing the internal disease. It's just not really addressing it. I guess Dr. Beal would call it, a lot of people would call it, you're manipulating the internal disease artificially with drugs. And Kate, I think that aspirin, painkillers, any anti is going to work against the body, and it's going to take the edge off, symptoms such as discomfort, pain, redness, heat, swelling, but it's not necessarily a suppressive. But of course, it always depends. And I know people get tired of my saying that, but there are situations, for example, a child with a high fever, you absolutely don't want to treat that with aspirin, because that's a very, very effective way, yes, of suppressing it. And what is the result? Often liver disease, liver failure, and some very, very serious consequences. And that's all just been learned clinically, which is why it's so important to put everything that we know in context. And an itchy skin, a red skin, an eruption, an ear problem may be problematic, but probably it's not life-threatening.
I think it's good to revisit the subject of pain, because I think that's something that should never really be allowed to continue. It's a difficult subject for me to talk about, because I can talk about it an awful lot, and then somebody says to me, so what do you do for pain? And I kind of duck my head a bit and go, well, we don't actually see it that often. So it's a difficult thing. I think if you're following a very natural philosophy and your veterinarian is doing a great job, then it's likely you're not actually going to see a huge amount of pain manifested. In the early days, when we used drugs a lot more in the work that we do, we used a lot more painkillers. So, maybe there's something that goes hand in hand with pain coming from organs that have been affected by suppression. I don't know, but if we suspect pain, we tend to turn to hemp products. We work with a couple of companies. We work with Canna Companion and also RX Vitamins. They both have excellent products, and they really help with pain, but they also help with healing. And we see some wonderful results which we can use alongside homeopathy without seeing an interference. And so I do think, if there is severe pain from I don't know, an osteosarcoma, some kind of cancer where it's undeniable that there really is severe pain and homeopathy isn't helping for whatever the reason, then absolutely. Then, we turn to the drug cupboard and we figure out what's the most important thing, what our veterinarian wants to use. And it's very important to do that when the time is right.
Okay. So it's just we've got a homeopathy hater, one of the people that we always enjoy conversing with here in the room today. So hopefully, maybe he'll bring up some good questions, and
that would be
that's always my favorite thing. And yes, I think that last statement, that the gentleman or lady who's not identifying him or herself as saying is very important, that homeopathy doesn't work. Well, to me, that is equivalent to saying the body is unable to heal, because all that homeopathy does is give the body a template or offer a template for healing. And if you're not...
It's also, I'm sorry, Jeff, I didn't mean to butt in. I was going to say, I think it's also important sometimes, and when I was a non-believer and I thought it was completely voodoo, I hadn't learned then that the premise that modern medicine gets fast results, natural medicine, holistic healing, takes a little time. It generally takes us a little while to get sick. And so we have to give remedies time to be responded to for the vital force to kick back up. And I think non-believers generally haven't had the experience of that time and waiting.
Yeah, and I think, because a veterinarian recently said to Jennifer that doing homeopathy is dangerous. And I think the only danger, whether it's homeopathy or natural medicine or holistic healing or drugs in general, I think that the only danger is when you're treating something and you're not sure what you're treating. You're not sure what the underlying problem is. And that's where putting everything in context is so important. You know, if I'm dealing with an older patient that I don't know what the diagnosis is, I don't really know what's going on, but it's got vague symptoms and appetite issues and energy is low. The first thing that I and any good homeopath or holistic healer is going to do is try and just get a baseline blood work, baseline examination, just doing the same thing that pretty much any other MD or veterinarian would be doing to try and stage and name the disease. It doesn't necessarily mean that we're going to use the name of the disease to treat the individual, but that, you know, I think that knowing what we're up against and knowing that quickly may be the reason that, you know, people like our friend today and the veterinarian who's Jennifer, that homeopathy either it doesn't work or it is dangerous. I think that is the danger that she's speaking of. Jennifer saying that the danger is homeopathy doesn't work. Well, that's what we just talked about. And animals die being treated homeopathically. Well, they die if you don't know what you're dealing with. And if you're delaying treatment, I mean, just like with Gail's diabetic, we're not letting our diabetic patients go into ketoacidosis and die from the diabetes. We're treating the underlying cause of the diabetes while at the same time, you know, controlling the blood sugar. The more that we can do that with homeopathy and natural healing, the better. But certainly does not mean that we're going to, you know, totally ignore what's going on physiologically. And that's really the big differences between what's going on physiologically, what's going on energetically. I think, like we talked about at the beginning, the energetic nature of disease, the vitality that allows the energetic nature of disease to exist, that's all but ignored in modern medicine. So, of course, homeopathy is said to not work because it works on something that doesn't exist.
I think it's also very valid for newcomers to homeopathy, particularly to animals, the animal world, to explain that a classical veterinary homeopath is actually a veterinarian, a fully qualified veterinarian in his own right or her own right, before they come to the world of homeopathy. And then most homeopaths, classical homeopaths, study for like 7 years maybe before they really go into business to be able to treat other people's animals. So when you actually come to work with a classical veterinary homeopath, you are working with someone with a huge amount of veterinary experience and homeopathic experience. It's a win-win situation. And I'd also like to say for our visitor that I've been working with homeopathy for 25 years in the work that we do with our senior animals. We've seen many, many miracles of healing. Before I came to homeopathy, I was terribly conventionally minded. I thought homeopathy was complete voodoo. And I had to be dragged kicking and screaming into the world of natural healing and also diet too. And I was shown so many miracles that I had no option but to continue. And the years go on and we see healing every single day of our lives, and animals who look bright-eyed, vital and healthy even when they're in their 20s. So, sorry, I'm stuck with it. Back to you, Jeff.
Yeah, no, I don't think I understand what you're saying, but I don't think you're stuck with it. I think that you, like many of us, would never let it go, no matter what other people say.
Well, homeopathy is flourishing, and the reason is because it works. So the challenge is if you don't believe it, then take a few little baby steps forward and start to see how it works.
Yeah. And I think that that's a very, very important point, that homeopathic medical care is the most common form of medicine in the world, and that the majority of the world does use homeopathy to some degree. And they wouldn't use it. The proof is in the pudding. People would not be using it if it weren't working. Back in the 1800s, and back when we were having fatal epidemic diseases, the patients, in some cases, 90% or 98% of the patients of allopaths, of people that didn't use homeopathy, they would die. But those same patients infected, or other patients that were infected with the same disease, treated with homeopathy almost always would survive. So I'm not sure how you can really argue the statistics. I mean, you're either alive, you're exposed to a fatal disease, you either live or you die. I mean, if homeopathic treatment can save a life, then I think that's really all that we should be worried about.
Mm-hmm.
So, okay, let's see. Sorry, I'm just trying one thing here. Okay, there we go. So I just wanted to, Keith and others have said they'd rather not even be having this discussion when there's somebody in the room that is a hater. And again, I think you and I both would agree, Gail, that we can use negative arguments to further our cause, but why should we immerse ourselves in that kind of disbelief and hatred? Because as Christina would say, and as I know we both know the truth, is we are the sum total of all the energies of all the people around us. And that if you surround yourself with happy, healing people, you're going to be happy and heal well yourself.
Totally agree. Totally agree.
And you practice that every day when you dole out some of your love sandwich.
That's absolutely right. We live by that, and it works.
So let's just scroll back a little bit and let me see if there's anything else that we want to cover before we talk a bit about the about further basics. Okay. Sorry, Christina is bandwidth challenged today, may not be able to join us at all, so I'm trying to scroll, read, and talk at the same time.
I'm very impressed. I don't know how you do it.
Okay. So anyway, Natalie had asked about the Berlin Wall remedy and whether it's been used or whether I've used it with animals. And my comment, Natalie, is, well, I guess the answer is no. And it's a definitive, strong no, because I only use, proven remedies in my practice. And I think one of the definitions of classical homeopathic practice is using medicines with known effects. And that's basically how homeopathy is employed nowadays. You take one series of medicines, you give them to healthy individuals, see what the effects are, and those are sick individuals that you can actually treat with the homeopathic medicines. The Berlin Wall and other speculative remedies or homeopathic medicines have never really received a proper proving. So if they're not well proven, I definitely do not recommend using them in practice. Then I wouldn't use them myself. Kale, do you have any of the homeopaths that you guys work with that use the Berlin Wall?
I have to be honest, I've never heard of it. No, all our homeopaths are dyed-in-the-wool classical homeopaths of many, many years, and they all follow the same principles that you do, and we stick very firmly to what's proven, very firmly. Let me ask you a question, Jeff. Do you find, people often ask me this question, do you find some diseases more difficult to treat than others? And I know your first answer is going to be just what Christina would be saying. She'd be holding up her thing saying, it depends.
That's exactly right. Because I've seen patients with virtually every named disease, some of which that heal quickly and some of which that are very, very difficult to treat. I guess, last night I was on a webinar meeting with a master human homeopath, and he was talking a lot about cancer and how cancers really have a mind of their own. And I'd say that if I have to give one general group of disorders that's difficult to treat, it's the patient with cancer. So we're not actually treating cancer. We're treating patients, and it happens to be a patient that has cancer. So yeah, I'd say in general that is or can be the most difficult to treat. But on the other hand, you can have a malignant tumor that is treated and goes away quickly, or doesn't go away but never causes a problem. I gave the example last week of the woman with breast cancer who had this ugly ulcerating mouth and went for a homeopathic treatment, and 40 years later came back with the same ugly ulcerated mouth, but it was 40 years later, and she'd had a great life. And isn't that what it's all about? The length and the quality of our life.
I'm just reading one of the notes on the side here, and it's prompting me to talk about a little bit, in as much I'm often asked how, in fact, when I asked you that question, I was thinking of maybe the two illnesses that I would choose that are sometimes more tricky and difficult to work with, and they would be hyperthyroidism and IBD. Now, the word cancer didn't even come into my mind at that point. And we're often asked about cancer and how we treat it and what we do for this, that, and the other. And I kind of come up against a bit of a stumbling block because I don't quite know how to answer it. In the last, 10, 15 years, we have had very few animals with cancer. Now, that's not to say that they've actually not had cancer. It would be very silly to say that we've cared for hundreds of animals and none of them have had cancer. However, very, very few of them have had professionally diagnosed cancer. Now, our animals get older. We work with homeopathy. We treat symptoms as the whole being as they appear, and we work towards end of life. If something acute or critical comes up, we turn to diagnostics as we need them. But we very rarely ever go deeply into the kind of diagnostic that would give us a title of a disease. Sometimes we assume that, well, I guess it's a possibility, and our homeopath carries on prescribing. And so we don't see our animals dying from some of the kind of acute symptoms you might expect from a cancer, these kinds of things. We see a natural progression toward the end of life. It just, it never that word doesn't come into our world. And if it does, we try to let it go, because I think it's very appropriate that once you put your own thought into something, you're giving it life, which is another thing where some veterinarians, some doctors do not tell their patients the name of the remedy they're prescribing. Doesn't happen so often in veterinary practice because animals don't really care about the name of what their medicine is, but humans do. And that's a really interesting discussion too, is whether if you know the name of the remedy and you actually read a little about it, are you then superimposing your own belief? And that seems to be quite a good discussion, I think. It's an interesting one.
Yeah.
It's all about it.
Yeah, well, that gets us into the whole idea of the non-material dose, the size of the dose. I think we've all had patients. I mean, how many people have gone to the doctor and just by going to the doctor and talking about their problems, they already feel better? Yes. And I think in the same vein that many of us have prescribed homeopathic medicines, and actually our patients have improved even before they take the physical substance. And I think, Alice, exactly what you said. I think that we have in our mind's eye, and we're thinking, and the quote unquote energy field is such that we have primed the pump for healing. And physics, the actual, the observations in physics have shown that the observer, just by observing, is going to affect the outcome of the experiment. So frequently, just having the intention to heal is going to help the healing process.
So much we don't understand about life and the world, and it's very clear that at the moment the world of modern medicine is very fastly starting to approach the world of quantum physics. The sciences are starting to meet in the middle, and it's going to be very interesting to see how that world develops. And there's homeopathy right in the middle there.
And of course, you're so right that modern science is really just now catching up to homeopathy. Homeopathic treatment, it's been around for 200 years. It's one of the most successful forms of therapy in the US before the advent of the modern scientific method, which basically booted out homeopathy. And that's a whole other story. And we'll get back to one of the comments that we talked about. But now I've lost my train of thought. Gail, was I just talking? Sorry.
You caught that off me because I'm always losing my train of thought. Where do we need to go next?
Right. That homeopathy, that modern medicine is just beginning to catch up with homeopathy. Actually, in my experience, people that best understand the healing of the body aren't necessarily doctors, but they're often physicists and true scientists that have an open mind and that are able to understand things like quantum mechanics and other aspects of the body that are not yet fully understood. It was really just until only recently where if you had a brain injury, that's it. Your brain was not going to heal, but now we know that brains regenerate, regrow neurons, that you rewire, and the same is pretty much true for the entire body. I think the scientific evidence now exists for heart muscle also actually regenerating and growing new and working hearts. Bears, after hibernation, bears routinely in kidney failure from not having urinated for most of the winter. And they forage and they eat herbs and things like nuts and seeds that help them actually regrow their kidneys every year. Yeah, we're told that kidneys, once your kidneys are shot, they're gone. But that's certainly not the case.
Wow, that's amazing. I have to start thinking about bears more now.
I've got. I'm thinking especially about one of my patients that only has one kidney. Was born with one kidney, and then that kidney started to fail. And here we are. He was given a few weeks to live, and here we are, many months later. The dog is regrowing its kidneys. Its kidney values are normal. It's not only back to doing agility, but it's competing as a canine athlete at the highest levels.
Oh my goodness me! What a wonderful case study. I hope you're
We're
writing
not
that
going to
one
let it
up.
up yet until they get the repeat ultrasound. Because we need, I think some documentation that the kidney is actually regrowing would be a lovely thing to see in writing. So,
it would be huge.
Michael had asked whether there's really just one approach to homeopathy. Let me just see exactly how he said it. I don't think he said approach. He said, can different homeopaths utilize vastly different approaches, or is it more regimented? Gail, I have my point of view, which is very limited, but Gail, you see a whole wide range of homeopaths because you guys have worked with probably dozens of them over the years. So how would you answer that question? Wow.
It's difficult to answer. Everybody is an individual, and repertorizing another being is very, very complicated to begin with in homeopathy. And so everybody, although they're following a protocol, which is very regimented, they have lots of little avenues to explore as they work through their choosing of the right remedy. And so I think what I see is a difference in the veterinarian who is some work a little bit it's hard to explain. Some come to a decision faster, and a lot work with their intuitive abilities, whereas some are very much more by the book. Everybody's a little bit different in their style. However, it really is a matter of interpreting what you're finding, because I think homeopathy is something you have to learn very methodically. It's a very difficult science. I mean, it is a science. I didn't used to believe that. It's very, very demanding in the learning process. But then once you've done the learning process, then you bring in yourself to the picture, and your intuition sits on top, and that can lead you in different directions. So everybody comes to the table with the same skills, and they use them a little differently. Does that
I
kind
think
of go
that it's exactly what I would have said, that homeopathy is a science, and like any other science, it may not be a hard science. Medicine is not a hard science like physics or chemistry, but it can be learned and it can be taught, because there are some underlying rules, scientific rules, that govern the forces of healing. And I think the number one rule that we haven't really emphasized enough, and it's actually the only natural law of healing that is needed for homeopathy, and that is that likes cure likes. So likes cures likes is the basic tenet of homeopathy, and by learning what is like a particular disease complex, we're able to treat it with homeopathic medicines, which, going back to proving those homeopathic medicines, we know can cause the same disease symptoms because they've been proven. And actually, the question that started this whole thing about different approaches to homeopathy, Texture Stelly asked about, or was wondering about, the use of homotoxicology as a different approach. Now, Kale, is homotoxicology homeopathy?
I don't know an awful lot about it. We've kind of crossed the path with practitioners a few times, but it's difficult for me because all my animals have their own veterinarians, and when somebody new comes along to offer a service to us, I'm not going to take risks and take chances and do something new unless I'm really sure. It's just never come to the right time that somebody has volunteered to help us using homotoxicology at the time when we've had an animal who would be really suitable to use. So I haven't really had any experience with it. Have you?
I've had no direct experience, a lot of indirect experience, and a lot of indirect clinical experience. And I can say pretty much unequivocally that homotoxicology is not an approach to homeopathy. Homotoxicology is using homeopathically prepared medicines in an allopathic or conventional way. So you're basically giving this for that. So every homeopathic tincture is a mixture of a bunch of different individual proven medicines, and then they're given for an injury. Let's say your intramural is probably one of the most commonly used, homotoxicology mixtures. But that's a very important distinction that we also, I don't think, talked about much here. That is the difference between homeopathy and homeopathic medicine, and using medicines that have been prepared homeopathically. They're not the same. Homeopathy is symptom and individual matching using the principle of like cures like. Homotoxicology is not. homotoxicology is basically the same as giving a natural drug for a specific problem.
I think a lot comes into play. I think when you're new to homeopathy, as I was in the old days, I was very fascinated by using combination remedies, which I guess homotoxicology is kind of based using combinations. And I thought for a little while, wow, this is great. You know, if we've got these different symptoms and we've got all these different remedies in this bottle, this is great. However, what you don't realize when you start to go down this path is, yes, you may get a good response. However, you have no idea which remedy worked and where you're going. So you really haven't gone anywhere along the path of healing. You basically just dealt with one of the symptoms, and you don't really understand what you've done, why you've done it, or how you've done it. So I don't think it can lead you very far, other than, I guess people rely on combinations a lot when you have a cold or the flu or something. And I think that they can be very, very good in that instance. Other than that, it just seems to muddle the picture to me.
Yeah, and that goes back to Keith's comment that there really is no such thing as, or she says, there really is no such thing as a real science. And to me, science it has definitely been sullied a lot recently. Like Amy said, half of the studies, the medical scientific studies that are out there are really designed more to push their agenda. The drug companies' agendas and specific drugs, rather than actually get to the root of the problem. And so, no, I would not call them real science. Real science is what Gail just said. It is you do something, you have an effect, and you can ascribe the effect directly to that thing that you use. Not an association, but cause and effect. And now that I know that this medicine causes this effect, I can use it in a curative fashion. I think one of the big issues nowadays is Lyme disease, and how many times pets and people are diagnosed with Lyme disease from guilt by association. The real science, as Kay would point out, the real science says, well, they have Lyme disease, give them antibiotics, and they get better. That's cause and effect. The antibiotic cured the Lyme disease. When the reality is that was just an association, and it may very well have been the body healing itself despite the antibiotics. What we do know for an absolute fact is that antibiotics disrupt the normal bacterial population of the body and can thereby actually cause more problems in the future than they're treating in the short run, short term. And that, I think, is an answer and a topic totally unrelated to what we first were talking about. Sorry.
I'm noticing that we're getting close to time now, but I'm thinking that maybe next week or sometime soon it would be interesting to delve a little bit into palliation versus cure, and when you might use palliation and quite what it is and how it works.
And I definitely think it's a great idea, especially if we talk about going back to the basics. It would be a great idea to talk further about the common versus normal symptoms, and then use that as a place to start talking about the nature of cure, the nature of suppression, and how suppression differs from palliation. And it's a very, very complicated subject that I think, Lyme disease is a really good way for us to talk about, are we suppressing Lyme disease or are we palliating Lyme disease by giving antibiotics? In my mind, suppression is not seen that often. Probably the most common manifestation of suppression nowadays is surgical suppression of a wart or of a tumor. And that's not to say that warts or tumors should not be treated when indicated. But, you've got a symptom, you do a manipulation, in this case surgery, and the symptom is gone, you've suppressed the symptom. Now, it's a whole other story, I think, Gail, that we should talk about at some point, maybe next week, about does the removal of a wart or tumor or suppression or treatment of any external lesion, does that necessarily mean that the health is going to be lowered, that the individual is going to have lower vitality and not be able to heal as well as it could? And is it that process of frequently suppressing, palliating, and manipulating symptoms, is it that process that actually may end up resulting in chronic degenerative diseases like cancers and other more serious autoimmune diseases?
Mm-hmm. I often wonder if that's why we see the results in our animals, because we don't, or we very rarely suppress with surgeries and things like that. However, if Christina was here again, she'd be holding up her "it depends." And sometimes I guess it does depend, and there are times where you need to go to surgery and suppress, because otherwise you're going to lose life. So in order to save a life, you have to go down that avenue, and then you work very hard afterwards to bring body, mind, and spirit back into focus again, into balance.
And that's exactly why we're here, everybody, to holistically address the body, mind, spirit, mental, emotional, physical bodies. And we look forward to talking further with you about that next week. Gail, any other things you want to say before we go? Because I do see our time is up.
No, I'm fine. There's plenty I'd love to say, but it'd take me another hour or so. So I think we should wait for next week.
Well, thank you so much for coming. Thank you all for coming and listening and participating. And that's really all I can say is thank you, thank you, thank you. And thank you for remaining open-minded and for being willing to treat holistically and even homeopathically.
Thank you, everybody.
Bye-bye.
Bye-bye.